This is John Sharp. There is a lot of talk about rapid provider adoption of telehealth since the beginning of the pandemic. But how are patients experiencing telehealth visits? I asked two patient advocates about their experiences and what they are hearing from their patient networks. Grace Cordovano is board-certified patient advocate, founder of Enlightening Results, and co-founder of Unblock Health. Jen Horenjeff is the founder and CEO of Savvy Cooperative. How patient-centric are these video visits? Grace noted that a patient who was having an emergency was able to avoid going to the emergency room, but only after calls to multiple providers. A very fragmented experience due to the lack of coordination between providers and interoperable data. Jen had a visit herself with one of her providers and was glad to engage with a specialist without having to travel. Are there particular advantages to telehealth for immune-compromised patients? They are glad to see the barriers to telehealth, both policy and reimbursement, coming down. There are both tangible as well as indescribable pros and cons to telehealth and in-person visits. While patients can avoid a hospital and clinic, they may still need in-person services such as labs and imaging. What about privacy and security? For some, finding a private place for a video call at home can be awkward. With children at home, the situation becomes more complicated. Not everyone has a safe space to do this. Are patients receptive to remote monitoring as another way to provide data to the provider without coming to the hospital or clinic? It is a definite win. Also, there are advantages for family caregivers caring for family at a distance. But patients are also savvy about data privacy and want transparency about how remote monitoring is being deployed and where the data goes. Are patients receptive to digital mental health services? These are a welcome offering, including everything from relaxation apps to mental health counseling via video. Overall, patients have adapted to telehealth quickly and appreciate the continuity of care and involvement of family caregivers in these sessions. Some obstacles and disjointed procedures need to be improved upon. Based on the rapid pace of change, patients see more advantages than downsides. To learn more about patient experience in telehealth, sign up for the HIMSS Accelerate Health series on a range of innovation topics.